This episode is sponsored by Relias, your trusted partner in workforce enablement. From onboarding and compliance to clinical upskilling, Relias helps healthcare and human service organizations build confident, resilient teams that deliver better outcomes. Check them out at relias.com.
Looking for expert speakers for your next event? Curt and Katie Vernoy, that's me, deliver engaging workshops on clinical, legal, ethical, and business topics. Give your audience practical tools to thrive as modern therapists. Learn more at therapyreimagined.com.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt with Katie Vernoy, and this is a podcast for therapists about the things that go on in our profession, the ways that we get to being professionals. And this is a topic that we haven't really returned to in quite a while, about clinical supervision and about ways that it can be better. I know that there's a lot of people, especially in pre-license years, that have a lot of things to say about how difficult the supervision process is and how unfair it is sometimes. And there's a lot of us on the supervision side that agree with you. And I am so happy to have Rachel Ledbetter from Motivo. She was one of the first people who reached out to us and supported us way back when we had the Therapy Reimagined conference and wanted to get involved with us. So I'm very glad that she's here to come back and talk with us about clinical supervision and about all of the wonderful stuff that she's doing. So thank you so much for joining us.
Love that. So happy to be here. Yes. And I remember that conference so well. It was like so fun. And
Super fun.
You guys haven't done those since the pandemic, right?
Yeah, that went away.
Yeah.
Unfortunately. But yeah, it was something where we were just getting started, and it was great having a conversation with you. And I think you were just getting started too. And
totally.
So,
can you believe we're still in business?
I know.
It's crazy. There's so many startups that struggle, especially in the mental health field. And I'm like, oh my God, I can't believe we've made it. So
we did. So I'm gonna give you the question that we ask all of our guests. Who are you and what are you putting out into the world?
Yes, Rachel Ledbetter, the CEO and co-founder of Motivo. I'm also a licensed marriage and family therapist. So raised in the South in North Georgia and went to school actually in California, and came across the problem of clinical supervision really through my own journey of getting licensed and then becoming a clinical supervisor myself. I can talk a little bit more about that, but I created a platform, Motivo, to provide virtual clinical supervision to people who need it. So about 20% of the people who use Motivo for clinical supervision are paying out of pocket for supervision. Maybe their employer doesn't provide it or doesn't have the right kind of supervision. But about 80% of the supervision on Motivo, an organization is paying for it. So we work with a lot of community mental health systems, health hospitals, federally qualified healthcare centers to be their supervision provider. That's most of what we do. And we've helped about 6,000 therapists get licensed over the last few years.
Usually, things like this get started because there's a problem. What was the problem that you were noticing and trying to address when you started Motivo?
Yeah, well, every state has a different set of rules for what it takes to get licensed, right? You guys know this. So I went to school in Southern California at Azusa Pacific University, got my LMFT degree. I don't know if you guys know this, you probably do, that there's more LMFTs in California than there is the rest of the country combined. So when I moved home to rural North Georgia, the idea of having an LMFT supervisor was difficult, and you had to have, based on Georgia's licensure rules, you had to be supervised for at least half of your hours by an AAMFT approved supervisor. So there weren't any in my rural North Georgia town, and supervision had to be face-to-face. So I found one in Atlanta, and I was driving, to meet with her 2 hours there and 2 hours back each week in order to get my supervision hours. The community mental health organization I worked for didn't have an LMFT. I was the only one at the organization. And so I was on my own for paying for my supervision. It was about $90 an hour. You need about 200 hours in the state of Georgia to get licensed. So supervision was just expensive. It was arduous. I felt privileged that I was even able to pay for it during that time in my life. But I know a lot of people who wouldn't have been able to. And so I stuck with it. I got licensed, and then I became an AAMFT approved supervisor myself just to help with that rural supervision problem. I noticed a few years later that states started changing their rules. Georgia changed theirs in 2015 to allow all supervision to occur remotely. And that's what gave me the idea for Motivo. Do not have a business background or a tech background, or like my undergrad is actually in Bible, which is not a super marketable skill. So I, was like, well, I just have an idea. I think if I created a platform, there's all these platforms getting clients connected to therapists. What if I created a platform that was getting supervisees connected with supervisors? And so I just gave that a shot. I created a little, test site on Shopify just to see if it would work, and it started taking off.
And it's really taken off. There's a lot of, I see you everywhere. I follow you on LinkedIn, and so I see you really engaging in the tech space and the mental health space. And so one of the questions I like to ask is, what do therapists need to know? We've got iterations of that. Sometimes it's what do therapists get wrong, but what do therapists need to know about clinical supervision and the advancements of technology and mental health? Because you're in it, like you're in it.
I don't think that grad programs do a great job. That sounds awful to say that to any grad programs that are listed on the call, but I think it's hard for them. They're focusing on teaching and training the clinical skills that they think that students are going to need as they enter the workforce. But especially with the rise of like online education, years ago, online education, people kind of turned their nose down to it a little bit. After COVID, it became almost every program has some sort of online function. And the idea that every graduate school is going to know how you're going to get licensed in your particular state that you come from is difficult. So a lot of clinicians, when they go to school, don't realize that they're kind of on their own after grad school. There is not a lot of help given. There is for your placement side and maybe for the supervision you need while in school. But once you graduate, you're on your own for finding a job. Oftentimes, I say this a lot, that the greenest clinicians are serving the most vulnerable populations, just the way that payer reimbursement works, that you can, reimburse for Medicaid, but you can't reimburse for commercial insurance as a pre-licensed therapist. It means that most of the people that we are able to see in the early years of our profession are people with high acuity needs, and you're just out there. You're going to throw them into the deep end a little bit. So, my MFT program taught me about Bowen's, theory of differentiation and family therapy and genograms and things that have been great for me, but not things, when I graduated, I started working in Skid Row in downtown Los Angeles. Family therapy was not something that I was using all that much as I was working with just how to get people from one day to the next, So I think that's something that clinicians don't realize, is that it's not just sitting in a private practice office right from the beginning. There's a lot to get through first.
Not only with the way that you're talking about clinicians, but also the process of being able to talk about delivering supervision online. That here in California, we were scrambling after the COVID pandemic and stay-at-home orders. We didn't have anything in place to do online supervision. I was meeting supervisees in parking lots so we could meet the face-to-face requirements while we talked on the phone to each other. But the last few years, we were catching up to places like Georgia when it comes to online supervision. And Motivo was kind of doing some of the research into the efficacy of how online supervision could work. What have you seen over the last several years in that process, also as it drags us into the 21st century as far as the effectiveness of it?
Well, as with many things in healthcare, the pandemic changed everything, right? So in California, prior to the pandemic, the rule that you could do virtual supervision if you worked in community mental health, an education setting, or a government setting. You couldn't do it if you were in private practice or for-profit. So that's the rule that changed. And it was, kind of extended order several times. You guys were probably very frustrated in California because they would do it at kind of like the last minute. And, people were scrambling and that sort of stuff. But what we saw was just this total change in it. New York didn't allow it at all. Now they allow it 100%. There's only one state, to my knowledge, that has rolled back their virtual supervision rules, and that was New Jersey here recently. But most other states have kept this intact. And what they basically say is like, there's not much lost from moving the supervision process online. In fact, there's like a lot gained. I don't know if this was the same for some of you, but when I worked in community mental health, the person who supervised me was whoever's available, whoever is available and meets the requirements. And so the idea that I could choose someone that fit within my clinical specialty, within my identities, within all of those things that were maybe important to me and the populations that I serve was a nice to have and not a have to have, And so I think the idea of virtual supervision helped allow supervision to be like more of your own choice. Who do you want to work with? Who is the right supervisor for you? Not just who's the closest, who's in the next office. So I've seen that really change, and I think it's to the benefit of the profession, honestly.
Is staff burnout impacting care quality? Are compliance tasks slowing you down? Relias helps healthcare and human services organizations turn these challenges into opportunities. The Relias platform unifies onboarding, compliance, clinical training, and performance tools tailored to your workflows and regulatory needs. Whether you're a behavioral health provider, a community-based organization, or a multi-site network, Relias simplifies complexity with automation, real-time reporting, and expert-authored content.
With Relias, you'll reduce turnover, streamline compliance, and gain the insights you need to drive real improvement. More than 12,000 organizations already trust Relias. Join them. Visit Relias.com to explore how they can support your mission.
The continuity that you're describing is also really critical because working in community mental health, I saw a lot of folks who would have to, they're in crisis, they have to do a whole case presentation to get to the question of then what do I do in this particular situation because their supervisor may not have been available and I needed to catch up so that I could give them informed feedback. And so being able to have a phone call or a Zoom call or whatever to be able to meet directly with your own supervisor who knows your cases and can continue to grow that skill set for you, I think is amazing.
Absolutely. Yeah. And I think, on that as well, when supervision is done internally, which there's great benefit to having supervision done internally, but there's also drawbacks to it as well. And some of the drawbacks can be that, you might be meeting with the person who's also your boss, who signs your paycheck. And, you might not want to tell them about some of the career things that you're thinking about. Or I know for me, working in Skid Row, my supervisor was very burnt out, not just on the profession, but also on the organization that we served. And it became a bit of a complaining session about productivity-based pay, no-shows, things like that. It was not about clinical skill development and the things that would really help me become a better clinician. So sometimes when you think about this idea of like picking the right supervisor for you, you can also have more freedom in like what's discussed and what matters to the development of a clinician, I think, as well.
Yeah, I hadn't even thought about that with the administrative supervision that a lot of my supervisors were, directed to give about productivity, about whatever, documentation requirements or, what's the evidence-based practice requiring of us and did you get that paperwork done? Unless you do extra supervision, you don't get to the clinical stuff except for high-level crisis. And so I like that this idea of having someone who's a little bit removed can focus on clinical and or mentorship. I love that idea. It makes it a lot cleaner and it makes it a lot more effective for growing clinicians from the beginning.
Yeah, I don't remember who coined the term, but I've heard it for years of administrative supervision versus restorative supervision. And that idea of like, you're learning. And also, these are the people who need that kind of learning and support the most. They're just getting out there into the field. So I think it's a great use of the supervision hour.
Katie used the word mentorship, and that's really kind of the through line that I'm hearing you talk about and being able to provide the consistency there as far as being able to give professional advice and to develop the supervisee beyond just what is happening with the clinical case that can happen in the community mental health that you're talking about. What other ways can supervisors better support early career therapists on their pathway towards licensure and independent practice?
Great question. I mean, I think there's a number of different things, roles that supervisors play. I can remember always hearing that supervisors were the gatekeeper of the profession. And I think that's a very important role of let me make sure that you're not going to do harm out there, that you're ready, all of that sort of stuff. But I think it expands much more beyond that of just helping them navigate the field in terms of licensure rules and regulations, helping them understand what might be expected on, the licensure exam, helping them understand like the different levels of the profession, the different types of clinical settings and how reimbursement works in those, teaching and training skills, of course. I would say definitely like self of the therapist and countertransference work is a huge one. I think that research shows that the most important indicator of client success is their relationship with the therapist. And I think beyond any kind of special models that you can use, like your ability to build a, safe and good relationship with your patients is huge. And that doesn't happen easily. That only happens by the clinician doing a lot of their own work in their own therapy, paying attention to that sort of stuff to know how to be able to do that. I would say the other thing that supervisors, I'd say, sometimes get wrong, at least I did when I was an early supervisor, is that my job wasn't to make this clinician into a mini me. My job was to help them become the kind of clinician that they were meant to be, and that might be very different from what I would do in a particular situation. So I really tried not to say, here's what I would have said, but more ask them thoughtful questions that would help them understand, what kind of approach they were using with the patient and what kind of clinical model they wanted to implement versus like what I would have done.
With the changes that are coming through the field, there's a lot with technology, there's potentially differences that are going to happen with health insurance, with all the different platforms that are coming out, AI therapy, all these things. There's so much that is shifting in our profession. How can clinical supervisors prepare early career therapists for these changes and making sure that they can still go the distance and find their particular place in the mental health profession?
I think part of it is letting them know that there is a different places within the mental health profession. And I hope I'm not getting on my soapbox here too much, but I see a lot on LinkedIn recently from clinicians that are just kind of beating the drum of we deserve more pay, we deserve more pay, we deserve more pay, which is absolutely true. Clinicians do deserve more pay. And if there is a company out there that can fix that for us in terms of higher reimbursement from insurance companies, great, like let's do that. But I think that I see it more from a perspective of, if you think about a lawyer, there are lawyers who go into the field simply to become public defenders, and they know what they're going to make and they know the population that they're going to serve, and they're entering into that willingly. There's other ones that want to be corporate lawyers and charge this much, but like thinking that all people can be served by a corporate lawyer isn't necessarily, I think, always going to be the case. I think there is some level of clinician and there's a difference in pay just based on reimbursement rate. And I like to, anytime I'm talking to a community mental health center, I'm like, make it super clear for your clinician. Show them what the reimbursement rate is for Medicaid. Show them how much they're making. Show them how much utilization manager is making, how much you're spending on reimbursement for mileage and office space, et cetera, so that people can understand we're not trying to underpay you. This is the number that we're starting with from insurance companies, and here's how we get to you. I believe that all therapists, or I would like to live in a world where all therapists are making great money, all of that sort of stuff. I don't think it's very practical when we think about the population. Did I get on to my soapbox too much there? I'd actually love to hear what you guys think about that very issue, because I feel like I'm a bit of an outlier and kind of in the minority on my thoughts on that. So I'd love to learn from y'all.
We'll include a link in our show notes to our previous episode on how money works, where we talk about this exactly for both community mental health agencies as well as private practices. But it's exactly the same thing that we talk about in that episode, which is it's not for a lack of desire, it's for a lack of the systems. And complaining to the right people is going to be where you actually make some gains on that. And that is going to be the people who set reimbursement rates, not necessarily the agency directors.
That's right.
We also have an episode on pre-licensees making a living wage. So we do have a lot of thoughts on this. But I think to your point, there are a lot of messages that say you should make a certain amount or you should have this type of job and all of that. We have another episode called What If You Hate Private Practice? Or what if you don't like? I don't remember. Whatever the title is, I'll put that link in the show notes at mtsgpodcast.com. But it is something where I think we're in agreement. And I think that the advocacy at the level of trying to increase reimbursement rates, all of those things, it feels a little daunting in the current environment. But I do believe that that is where the work needs to be done, and determining how you navigate the current system where there's going to be AI solutions, there's going to be self-help solutions that are going to eat away at, the clients that we're able to see. And so I think it's just being able to understand the landscape of what's actually happening. And you've been immersed in that and have gone from being a mental health professional to being, a founder of a startup. And so maybe you can reflect on that journey and what you've learned about kind of the other side of the profession.
Totally. Yeah. And, I have to say, I think we just got lucky, Motivo. And I say that a lot because timing is everything when it comes to being a successful startup. Motivo 5 years from now would probably not have the success that it had, or 5 years early. If the pandemic didn't happen, Motivo probably wouldn't even be in business right now because there weren't enough people who needed supervision that were paying out of pocket that we could have generated, revenue. And there weren't enough businesses that were going to pay for supervision when it's not allowed in most states or it's restricted in a lot of states, And this also goes along with the funding cycles as well. Motivo has raised about $25 million from investors, and all investors' eyes were on mental health and healthcare during the early days of the pandemic. So a lot of the digital health startups that you have seen come out of the last 5 years got funded. They actually got overfunded at too high of a valuation during that time. Motivo didn't get overfunded because most investors were like, what's this supervision problem? That doesn't seem like a big deal, So it was very hard for us to raise money. That ended up working very well for Motivo because we didn't have this high valuation that we had to grow into. I hope I'm not getting too technical with the venture language. I will say that investors are no longer interested in mental health startups by and large. They're interested in AI right now, and that's how they work. They have their thing, and this is what we're investing in, And so mental health founders who have a great idea should just know that timing is a lot of whether or not you're going to be able to make a go of it. And Motivo just happened to be at the right place at the right time. I didn't do anything that made it happen. It just happened to work.
What is it like being a founder of a company that's been fairly successful in this other space?
I guess I don't think of us as successful yet, mostly because I work from my pajamas in my house all the time. So I'm not I guess, yes. I mean, I can acknowledge that our success, we have 30 employees and, we're doing well as a company. But yeah, I don't know. I think that I'm surprised, definitely. I'm tired, definitely. It's a lot of work and it's a lot of learning. I think this sounds so horrible to come on a podcast and be like, I'm so tired. But I am exhausted from the process of learning. I feel like I have just been, Motivo's just now getting to the point to where every day doesn't feel like I'm pushing this impossible boulder up a hill. And those early days of a startup are they probably seem like the early days of starting a private practice, where you're just like trying to get the wheels turning. So it's been hard, but it's been rewarding. And I just mostly feel grateful that we're able to do this work.
Need dynamic, knowledgeable speakers for your next event, training, or conference? Curt Widhelm, that's me, and Katie Vernoy, that's her, bring real-world expertise to every presentation, covering topics like supervision, private practice growth, and therapist burnout. Our workshops are interactive, insightful, and packed with actionable strategies to help modern therapists succeed.
Whether you're planning a team training or a large-scale event, Curt and I deliver high-impact learning experiences tailored to your needs. Book us today. Visit therapyreimagined.com to learn more.
Where do you see with things like AI coming down the pike? Where do you see that coming for pre-licensed clinicians? I guess this is kind of more of a question also of how does Motivo work? Are you telling supervisors like, hey, here's how we as a company are feeling that the field is going, and these might be things that you want to talk about in your mentorship?
It's a good question. For the fact that I run like a mental health tech company, I don't pay a lot of attention to what else is happening out there, and I probably should. With AI, I think this is a great force multiplier. I think about myself coming home after a long day of in-person, community-based counseling, going from home to home to home, and having 8 case notes that I needed to do before the next day so I didn't get too behind. If I had an AI tool that was listening in to my sessions and wrote the SOAP notes for me, oh my goodness, it would have been life-changing to me. And so I see AI as being definitely an added tool. I do not see it ever being a replacement for therapy. I mean, what do I know? Like, I don't really know what they'll try to do with it, but I would be sad. Maybe I'll eat my words some days, but I would be sad if in 20 years AI was a bit of a replacement for therapists. That sounds awful. I see it as how can we use it to make therapists' lives easier. A quick word of like caution though, what I'm afraid is going to happen is that we're going to use these AI tools and then employers are going to start increasing productivity because they don't have as much time doing case notes,
Don't
right?
give them ideas.
They've already thought of it. I know they've already thought of it. And I'm like, don't do that. Like being a therapist, especially in a community-based setting, is hard enough. Like, let's make it easier on them just for the sake of making it easier on them.
How do you think clinical supervision will continue to iterate as supervisors get more familiar with virtual supervision and the different tools they might be able to use?
Yeah, I was just on this call the other day where we were talking about Elios Health. It's another great mental health company that I really like, and it does concurrent documentation, AI tool in that way. But it also does like fidelity monitoring, meaning like if you want to do EMDR therapy, then this tool will help guide you through that and document it as you go and help ensure that you are maintaining fidelity to an evidence-based practice. When I was a supervisor, I can remember just kind of being like, anybody have anything they want to talk about? Or like staff a case. But if I had tools that were listening into the clinical supervision session to tell me how to guide somebody through a specific model that they were trained in and wanted to use, if I as a clinician had tools that were telling me how to implement motivational interviewing in an evidence-based way into my sessions, I think that would be a great thing. So I think our access to information at the time that we need it most, like when we're right in front of a client or a supervisee, is something that can be enhanced with technology. I also just think, we've already built an AI tool at Motivo that just scrapes boards' websites and gets rules and requirements. So we can ask our tool how many hours of supervision are needed in Missouri for an LCSW, how many of those hours can be in person versus virtual supervision. These archaic board websites have the information, but nobody's compiled it into one place.
What's coming up next for Motivo? Do you have future plans of continuing to expand out?
Yeah, mostly what we want to do, like the biggest kryptonite for startups is distraction. you can very easily become Frankenstein with your product. And if you even think about some of these old electronic medical records, it's like, what can you not do? Like, there's so many tabs, there's so many options, and people like clean experiences with an app or a dashboard now. They want to be able to be like, here's what I need. I know how to navigate this. So really, my goal with Motivo is just to do the best clinical supervision we can do, to give people faith that we have vetted their clinical supervisors. The number one board complaint, by the way, the number one board complaint about supervision is that they find out at the end that their supervisor didn't meet the qualifications to provide supervision. And I can't think of anything worse than getting to the end of your hours and learning that your hours don't count. So the fact that Motivo takes that burden of not only are we making sure your supervisor meets the requirements, but we're also monitoring the board's website every single month to make sure there's not any disciplinary actions, that they haven't lost their license for any reasons, all of that sort of stuff. So I just want to be the place that just people think like, wow, that was excellent supervision experience for me. Beyond that, I don't know. I just want to do that. I want to solve that problem. And I don't know. I think that that's kind of what I want to give to the world.
So there are two types of folks that you're probably wanting to connect with, obviously, or maybe even three types of folks. So we've got the clinical supervisees who need to find supervision, out of pocket, that kind of stuff, community mental health organizations that have a supervision gap that need folks to come in and fill it. And then there's also those of us who could be available for clinical supervision. How does that work?
Yeah, so definitely going to our website. If you're a supervisee or an organization, motivohealth.com, you can contact me directly, Rachel, Rachel, at motivohealth.com. For supervisors, you can also go to the website, but know that we have a big supply of supervisors. We have about 1,500 today. We have a couple thousand on our wait list waiting for an opportunity to supervise with Motivo. I think that's mainly because we were like the first ones to do clinical supervision. So it was very easy for us to attract supervisors. Also, supervisors, it's just usually something that they're doing on the side of their desk. So they don't, like most people want to be able to offer like a few hours of supervision if they meet the qualification. So I would just, kind of examine your expectation, kind of limit your expectations for how much we might need supervisors. We need them in some of our more rural, like smaller states. California, we're doing quite well in terms of like supervisor supply, but we'd still love to have you and come and definitely apply if you'd like to. We pull people as soon as we need them, especially if you have a specific specialty or something and somebody asks for that, we'll kind of expedite it.
What states do you know? Which states you're needing folks?
We definitely need more in New York. We always do. More LCSWs in New York. Probably Oregon and Washington are two states. Tennessee, we might need some more. That's probably it.
Okay, great. Because we have listeners in all 50 states. So
great. Love that.
So if you're in one of those states, make sure that you check out Motivo if you're wanting to do some supervision.
Yes.
So we will link to Motivo in our show notes, and Katie will probably also throw your LinkedIn in there. Is there anything else that you want to share for people to find out about you and the work that you're doing?
Yeah, just my email's fine. I'm super accessible. I love talking to supervisors. I love talking to supervisees, but I also love talking to like budding entrepreneurs. That's kind of the role that I'm playing now, that I don't work 80 hours a week anymore. Now it's like, what can I do to like just enhance the profession? And part of what I like to do is talk to early founders and just like shooting, whatever. I was about to say shooting the shit, but I don't know if I can say that. But like, just
it's the internet. You can cuss.
Okay, good. But just chatting about what's your idea, and I can give you my thoughts and perspective on it, and you can give me your thoughts and perspective on my ideas, like that sort of stuff. I love that.
And you can find those links in our show notes over at mtsgpodcast.com, and follow us on our social media. Join our Facebook group, the Modern Therapist Group, to continue on with these conversations. And until next time, I'm Curt Wilhelm with Katie Vernoy and Rachel Ledbetter.
Thanks again to Relias for supporting this episode. If you're ready to reduce risk, retain talent, and improve care, visit Relias.com and schedule your personalized demo today.
Want expert training for your team or event? Katie and I offer engaging workshops with real-world strategies for modern therapists. Visit therapyreimagined.com to learn more and book today.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.